Hi, my name is Michelle Armstrong. I'm a registered nurse and licensed professional counselor certified by the National Board for Counselor Certification, and will be presenting an episodic SOAP note video on the topic of streptococcal pharyngitis. The patient in this scenario presented with a chief complaint of my glands feel swollen. The patient was a 22-year-old white male in usual state of good health until 2 days ago. The patient complained of acute onset swollen and tender glands in his neck, sore throat, fever, headache, and malaise. The patient denied chills and sweats, watery, sticky, or irritated eyes, sinus discomfort, ear pain, cough, stuffy or runny nose, sneezing, ulcerative stomatitis, hoarseness, abdominal pain, nausea, and vomiting, as well as diarrhea, vesicles or ulcers on the palms of his hand and soles of his feet, and rash. The patient stated that his swelling, tenderness, soreness, fever, and headache seemed to be pretty constant and intensifying. The patient also stated that his glandular discomfort and throat soreness were worse in the morning, with fever, headache, and malaise worsening as the day progressed. The patient denied radiation of glandular or pharyngeal pain and headache. The patient stated that throat discomfort was aggravated with swallowing, but relieved by sucking on Jolly Ranchers and cough drops, drinking nectar, gargling with salt water, and running a humidifier. The patient reported that ibuprofen relieved his fever and headache and rested his malaise. The patient states that he babysat his 5-year-old nephew 2 days ago, and the nephew had just been diagnosed with strep throat. In completing a review of systems with this patient, the patient reported that he did have fever and malaise, but denied recent weight changes, chills, sweats, weakness, and fatigue. The patient denied having vesicles or ulcers on the palms of his hands or the soles of his feet, and denied having a rash. The patient reported that he did have a headache, but denied excessive tearing, ocular discharge, and irritation, as well as earache, infection, or discharge. The patient denied having frequent colds, nasal congestion, nasal discharge, sneezing, or sinus trouble. The patient did note that he had a sore throat and was experiencing dysphagia, but denied ulcerative stomatitis and hoarseness. The patient did report that he has swollen tender glands in his neck, but denied cough, dyspnea, and wheezing. The patient denied having heart trouble, high blood pressure, rheumatic fever, heart murmurs, chest pain, or discomfort. The patient did report having dysphagia, denied anorexia, nausea, vomiting, and diarrhea, abdominal pain, including periumbilical pain,